I'm Vijay Khatri. I'm a professor of surgery at University of California, Davis in Sacramento, California, in the Department of Surgery and Division of Surgical Oncology. I think seeing how electronic and technology plays such an important role in our daily lives, it is here to stay, and we have to adapt to it and make sure that that's a method of sending out education, and we see that with our young generation of medical students, residents, fellows, and even young faculty. And I think it allows them to be more effective as well, because let's say, for example, my own first textbook that was published with W.B. Saunders, now with Elsevier, it was Dr. Juan Asensio and myself. We put that book called The Operative Surgery Manual, about 50 operations, and sort of targeted towards medical students and young residents. And once it became available on MD Console, it really did take off, because now they don't necessarily have to have the book with them, or even but they can go ahead and prepare themselves for the surgery by easily just looking at that one operation the day before, or even immediately before the surgery. So it's a great immediate access of resource for these sort of up and coming trainees in medicine, and particularly surgeons as well. Well, my thought was it was going to be a stepping stone to the next level after the initial operative surgery manual, which was an introduction to surgical procedures. So what I wanted to do was have a compendium, an atlas, where it put together a more advanced procedures which would be done by more experienced surgeons, or surgeons who are in private practice for a while, or they can use that as a reference and put that all together in one textbooks. And this particular textbooks, I wanted to make sure that it was broad-based and had authors which were from throughout the world. I mean, we have contributors not only from the United States, but from Europe, Asia, in Korea, as well as Australia and South America, because really I think in this global arena we can get the best surgeons from the various continents, and what I've done in this particular atlas is select individuals who are well known and have published well in that on that particular topic and technique of performing the operation. And we have included, and we've tried to be up to date, so we've included laparoscopic surgery, as well as Notes cholecystectomy, which was also pioneered both in South America and in the United States. So if you really look at it, it can be general surgeons as broad, but the table of contents addresses head and neck surgery, thoracic surgery, the entire GI tract surgery, soft tissue resections, as well as complex resections of sarcomas. We also include vascular surgery, urologic, gynecologic. So it's very broad based, so that it can be used by several different specialties, and in addition to those in surgery, can also be used by allied healthcare providers, such as those who are nurse practitioners, or OR technicians, or OR nurses. They can use that as a resource for preparing for a surgery.